October is Breast Cancer Awareness Month, and did you know that 1 out of every 8 women are diagnosed with some form of breast cancer?
A statistic nobody wants to hear or live through. WENY's Lindsay Madison spoke with 2 women about their experience with breast cancer and when doctors say you should get screened. Lindsay?
Nick and Renata, just this year, over 300,000 women are expected to receive a breast cancer diagnosis. The type of cancer and treatment can look different for everyone, but catching it early can save lives. I spoke with an Arnott doctor and 2 women who say they're still here because of early detection.
2005. I was 46 years old. I was a little shocked.
Mammograms are a critical component in finding early signs of breast cancer. The chair of radiology with Arnott Health says early detection can save lives.
Since about the 1980s, over the last 50 years, we've seen over 40% decrease in mortality of women's breast cancer because of early detection, better treatment, the whole gamut.
Most people know a friend or family member who has or had cancer. Nancy Wenzel is a 2-time breast cancer survivor, a mother of 3, and also my grandmother. She was diagnosed with breast cancer the first time in 2005 and was cancer-free from 2006 until 2021.
The second time around, I had some discomfort. Just the way the seatbelt sat across my breast. I was having this little bit of not a stabbing pain, but something didn't feel right.
Wenzel gives herself breast exams and goes for regular mammograms. After she found out she had breast cancer again, it was recommended she get a mastectomy.
I struggled with that quite a bit. I considered reconstruction first and actually started reconstruction procedure, but in the end decided that the best thing to do was just to have mastectomy.
After the surgery, Wenzel started chemotherapy and then took a cancer drug called Lynparza for a year. Wenzel is currently cancer-free, but some women are unfortunately beginning their breast cancer battle. Dawn Steele, stepmom to Renata, was diagnosed with breast cancer in July. She begins chemotherapy on Friday and will also later receive radiation. Steele says she has a family history of breast cancer and was high risk of getting the disease.
I tested every year. I go for my mammograms, and mine was caught this time. I've had biopsies done in the past, so I wasn't too awful nervous when they had me come back, for a biopsy, but wasn't pleased with the result on this one.
While Steele has a family history, her form of breast cancer was caught early. She urges people to get mammograms done regularly.
Don't put it off. Don't be afraid of it. It's really not that bad of a test to have done. Get those mammograms done. Do your self-checks. Be your own advocate. If you have to do it. Don't put it off.
Federal health guidelines recommend women should begin annual mammograms to screen for breast cancer at age 40. But some women should be screened earlier, depending on their family history and risk level.
Now, we have stepped that up in patients who have, say, a strong family history, where, say, the mother developed breast cancer at the age of 40. We might actually start that screening earlier, perhaps at the age of 30.
Dawn and Nancy say they've been able to keep going because of all the support they received. Both women say cancer was difficult for them, but they're not letting it define them.